Hello, hello everyone. Good morning, good afternoon, or good evening, everyone. My name is Santi Gomez. I am the Global Director of Research and Programs for the Gasol Foundation. The Gasol Foundation is a non-for-profit organization dedicated to preventing childhood obesity by promoting healthy habits and creating healthy environments where children can grow up healthy. Today, we have connected a diverse audience from various countries, including Italy, Ukraine, Spain, Mexico, and others. And we know that many of you are joining us again after the first and the second webinar that we celebrated in the framework of this interesting project that the name is HEAL, Healthy and Accessible Lifestyles for All. HEAL is a project funded by the Erasmus Plus grant from the European Commission, and the main goal of the HEAL project is to ensure that children and young people from disadvantaged groups have meaningful opportunities to lead healthy lifestyles by empowering grassroots sports organizations and strengthening community networks. Today, in this third webinar, we have the great pleasure to introduce you Dr. Luis Cereijo. Luis is an assistant professor at the Faculty of Medicine and Health Science at University of Alcalá in the Madrid Spanish region. His research focused on inequalities in exercise and physical activity and their contribution to social inequalities in health across the life course. His work also examines the social determinants of health and the urban health. In addition to publishing in various international scientific journals and conference proceedings, he has a presence in the media where he engages in science communication and advocates for health equity, an important concept. He also collaborates with public institutions such as the Ministry of Health in Spain on the evaluation and development of public policies aimed at addressing social inequalities in health. In fact, with Dr. Luis Cereijo, we have the pleasure of sharing different projects in science, in applied science in Spain. So now it's time for Luis. Welcome, Luis, to this important webinar that also we are going to record to properly disseminate after today. And we are fully sure that the strategies and data that you are going to share with the audience will be highly valuable to try to move the conversation beyond positioning the individual responsibility on practicing or not physical activity, and obviously trying to avoid generating discrimination to population that have less access to practice physical activity according to the inequality access that maybe they are suffering. So thank you very much, Luis, and the floor is yours.
Thank you, Santi, and thank you everyone for being here. Thank you to the HEAL project and to the Gasol Foundation for inviting me to be part of this webinar. I know the project, I know HEAL. I think it's a very important and exciting project for everyone. Focus on the mission to try to make healthy lifestyles available for everyone. So yeah, I will try to frame. Okay, I will share my screen. Let me 1 second. Okay. Can you see the screen? No, yeah. Okay.
Yes, we can see properly, Luis.
Okay, thank you, Santi. And yeah, my talk today, I would like to talk about something that in appearance could be very simple, but it's also very important, that the idea that physical activity is not just a matter of individual choice. And if we really want to promote active lifestyles to everyone, we need to rethink our perspective on how physical activity works and how our structures, our society's structures condition the access to physical activity. Santi said, I'm a professor in the University of Alcalá, so sorry, but I need to start with some theory on that. For that, I go to the classics. Jeffrey Rose. Jeffrey Rose is considered one of the fathers of social epidemiology, which is my scientific field. And Jeffrey Rose wrote a paper in 1985 entitled Sick Individuals and Sick Populations. In this paper, he asked about how the Faculty of Medicines teach to students on how to arrive to a diagnosis of our patients. And using this example to our topic on physical activity, we can say that usually we use this type of question: why some individuals are physically inactive? This is an individual question, and indeed is so useful and have been so useful for decades to try to understand the spreads of the disease. But this individual question only gives us individual answers. When we talk about the individual perspective of physical activity and why some individuals have lower levels of physical activity, we use to find the type of answers related to lack of motivation, lack of knowledge, lack of disciplines, all this message based on just do it, and how from an individual perspective you can be active. And these answers somehow could be true in a way, but doesn't answer the entire reality of our people. This is the individual approach or high-risk approach. And as I said before, it's useful in some part of the medicine and public health. However, Jeffrey Rose said, what happens if we ask about populations? Instead of why individuals are physically inactive, what happens if we ask why some populations have higher levels of physical activity and others has lower levels of physical activity? When we talk about populations, we need to find the answer in the structures of our lives. When you try to understand which reasons explains that a lot of people have a lower level of physical activity than other big group of people, you should talk about working conditions, neighborhood designs, availability of facilities, access to those facilities. You talk about daily lives. This is the population approach. And the population approach is not important only because of the diagnosis of the situation or the analysis of the situation. It's also important because when you develop solutions from a structural perspective, you are developing intervention, radical intervention, in the sense that you are acting on the real root of the problem. And when you act on the root of the problem, when your intervention is not about motivation, but it's about creating new green spaces, it's not about educational programs, but it's about how to create a safety, a space for childhood physical activity, you can achieve a population change, a big change. Jeffrey Rose called all these structural determinants massive cause of disease. And for sure, physical activity inequality have a set of massive cause of inequality. Physical inactivity is not about what people want to do. It's about what people are able to do. for that, we need to understand what is inequality. Inequality is not a dichotomous concept about rich or poor people. It's a social gradient shaped by a set of determinants and factors and excess of inequality that run through our lives. These determinants, these access of inequalities, and how the differential effect of these determinants impact on our lives put us in one point or another along that social gradient. So therefore, inequality is not a matter of extremes. Everyone are subject to inequality. It's about the entire population. All of us are impacted by inequality. The only thing is some people are affected from some determinants of some axes of inequality, and other people are affected by other axes of inequality. So when we decide to address inequality in our topic on physical activity inequality, we are not talking about how to improve the life of poor people. It's about how we improve the quality of life of the entire population. It's about our neighborhoods, our cities, our countries, our world in general. So if inequality is about a set of different determinants and axes of inequalities, we need to understand that physical activity inequality is a multi-level challenge. Here in this image, we have two different frameworks. We have a very important framework on the left, which is the social determinants of health framework, and we have on the right the socio-ecological framework of physical activity. Going in detail on that, in the social determinants of health, the social determinants of health framework is a framework developed in the 2000, at the end of the 2000s by the World Health Organization. This framework talks about different levels of inequality. The first one is related to the socio-political and economic structure of our lives. And some of you could say, hey, what the heck? How sociopolitical and economic structure affect physical activity? Affect in the sense that how are the labor conditions of a country? How are the welfare state of a country? How is the traditional culture and the traditional politic culture of the countries create the original opportunities to practice physical activity? It's not the same to live in a European country with a very strong social state, with a national health system, with an educational public system, etc., than live in another country without all of that. And this first level create the first provision of resources and opportunities. But after that, we have the axis of inequality. The axis of inequality are different identities of the populations and individuals that condition the provision of resources and power. Those are social class, gender, country of origin, disability. If I live in an urban area or a rural area, age. And depending on how all of these axes through my life and how these axes define my capacities, I have a better position in the social gradient of inequality or a worse position. And that means you can have a high level income, you can be part of the high tercile of income of your country, but it's not the same be part of this tercile being a man than being a woman. Because there are different inequalities related to the gender. It's not the same to be an adult that you have power to decide than be a child where your opinion is not usually listened. And the intersection of these two levels create the material condition of life related to the income level, living conditions, labor conditions, your responsibilities on caregiving, etc., and cares in your home. How is your neighborhood? So all of these levels are interacting to create a situation, a context in the structural perspective of evaluation that condition your capacity to have a life with higher levels of physical activity. Imagine, for example, imagine 14 years old girl from a high income level, living in a little town in a rural area in Spain or Italy, wherever. This girl wants to be active, but in her village, she has only one sport court for football and one sport club for football. And the society say to her that football is not for her. Football is a masculine sport. What is the capacity of this girl to be physically active? How she could have real opportunity, despite of the income level that she has, to have a physical activity, accurate physical activity level in her life. Or imagine a woman in an urban area in whatever, Paris. She has a very good job. She has a good income. She's mother. She has 35 years old, and she's mother. Who is the responsible for caregiving in her home? Who has the time? Who has the energy? Time is the most important determinant of inequality in our lives. And it's not only about time, especially in physical activity. It's more about the quality of this time. This woman from high-income country don't have enough quality time to practice physical activity. So we need to understand all of these determinants and how they interact between them. In the right side of the picture, we have the sociological framework of physical activity. It's very common in physical activity. Almost of you could see this framework before. It's more related about how is our closer context on physical activity. This framework shows us 4 very important environments. Interpersonal relationships. How are my peers? How are my family? If I'm a child, how are my parents or my caregivers? They practice usually physical activity or not? They are healthy. How is their works? They have time to share with me in the park, playing, whatever. How are my colleagues? Usually, my peers are very similar to me, as me. If I have fathers, mothers with a lot of work obligations and very low income, my peers will live the same situation. All of these reference and all of these potential companies on physical activity condition my possibilities. Next, we have the social context that is related to the social capital of my neighborhood. Social context in physical activity is about how many sport clubs I have and how are that sport clubs. My sport clubs, I have a diversity of sport clubs and sport associations, or I have, I don't know, 6, 7 clubs of football or basketball, and 1 or two from different sports, or I have a diversity of sport clubs. I have an open offer to practice, are free or not free, are related to built environment or are independent to built environment. these sport clubs and the social context are for childhood population and adolescents, or my caregivers, fathers, mothers, uncles, etc., have also enough social offer to practice physical activity. Because the intersection of all of that create the physical activity environment. And we have the built environment, which is the most knowledge environment on the sociological framework, is related to the provision of built resources to practice physical activity, such as exercise facilities, parks, green spaces, blue spaces, playgrounds, etc., etc. How many built environment I have, but not only how many. And here I want to introduce another important framework. In the 80s, two researchers, Penchasky and Thomas, stated that the axis is composed by a set of dimensions of axes. And to evaluate accurately the access to resources, we need to consider all these dimensions. Two of them are very famous. Proximity, that instance that I have the resources from my home, and availability, the number of resources that I have around my home. Great. But what about affordability, which is the relation between the cost to access to this resource with my capacity to pay it? My resources are affordable for me or not? And what about accommodation? Which are the opening hours of the resources, and what are my available times in my daily life? I can use this resource or not? And what about acceptability, which is the relation between the culture and norms of one resource, one space, one environment, with my culture and norms? I will feel accepted in this space or not? I will feel comfortable in a gym or not? Well, depends on who I am. If I am a white man, despite the socioeconomic level, I would find a lot of space for practice. What happens if I am a woman? What happens if I have obesity? What happens if I whatever? So to understand the access that our offer of physical activity provide to the population, we need to understand all of these things. Some of them are related to the structural condition of life or of our societies, but others are related to how we design the physical activity space of practice. I'm sorry, but this is not the only one determinant. We need to understand that physical activity is a social practice. And as it is a social practice, depending on which moment of my life I am, my physical activity will be different. This is the perspective of the life course approach of physical activity. If I'm a childhood, I don't need a lot of things to practice physical activity. Actually, I only need a safe place, accessible not only for me, but also for my peers. And I want to practice free play, social play with my peers without any condition that modify my desires. But if I'm a child, I am not independent. I am not autonomous. I need caregivers that pay attention to me. So, and on this stage, the condition of life of my parents will have an impact to my access to physical activity. Then in the adolescence stage, appears a very, very, very strong force, which is the social pressure. And it's different for boys than for girls. But in girls, in adolescence, start to appear the body image pressure. The body image pressure have the capacity to transform physical activity into a stigma, one pressure more to condition your life. And physical activity suddenly is not about enjoy, it's not about fun. It's about how can I fix in the society expectations. We need to pay attention on that, to shape our programs, to create physical activity spaces accessible and how to say I don't remember the word neither in Spanish. Inclusive spaces for everyone. And then change again. Young adulthood appears, academic career, early work career, a lot of workload pressure, etc. Adulthood, when you start to change another stage of life with maybe you are a mother, father, whatever, you have responsibilities, etc. So these two frameworks is important in practice in terms that for coaches, organizations, and those people working in sport, these two frameworks means that we need to adapt our activity to the real lives. We need to reduce barriers. We cannot create a space of practice despite or isolated of the real life of the populations. We need to reduce barriers. We need to understand how is our populations, which type of inequalities impact on their lives, to create new spaces that provide real and effective physical activity. We need to create inclusive environments. We need to rethink how feels welcome in our spaces. Sometimes the problem, as I said before, is not access. The problem with physical activity is not the provision of physical activity resources. Sometimes it's about the feeling of not belonging to these spaces. So physical activity shouldn't feel like a test and shouldn't feel like a judgment or an obligation. Physical activity should feel like a space where people feel comfortable, included, and able to participate. Those two frameworks allow us to collect the information of our populations to create new spaces of activity for everyone. Trying to show you some specific examples of interventions based on this, I choose only one, which is related to playgrounds, which is an obsession for me now. How we design a space of activities for children. Here we have two different playgrounds here in Spain. The left one is the very, very, very common in our schools. And the right one is an example of the new playgrounds that we are designing in our country. Both of them, at the beginning, could provide physical activity, but I want to share with you some questions related to this space. Who decides the design of children's physical activity spaces? This space answer to the childhood desires or to the adulthood desires? Which genders do these spaces or designs appeal to? How many different activities do they encourage? Are they adapted to the climate crisis? And is there a space for symbolic play and creativity? What happened for that? The play is one of the most important engines of human development that our childhood population have. We need to give more space for creativity, for symbolic play. When we design spaces for football, basketball, etc., it's not a childhood decision, it's an adulthood decision. We need to rethink the design of childhood population spaces. And related to the gender gap, here, three images from a study developed in Barcelona 2 years ago. This was a study using GPS. Different children from a school use a GPS during a week, during the, I don't know how to say, leisure time in the playground. Can you guess which color is for boys and which color is for girls? That's the problem. Our spaces are genderized. And if you pay attention on the graphic, this is the entire playground. For me, energy expenditure is not the most important thing of physical activity, but obviously it's important. Where the childhood population, the children practice high, moderate to intense activity. Here. We need to modify our spaces because the spaces of activity, following the first two frameworks that I share with you, are designed to create new inequalities in physical activity. One example of that is a program developed in Barcelona. It's called Transformem els Patis. Let's transform the playgrounds. They have carried out different interventions in a set of schools from Barcelona in Catalonia, Spain. And now they are reporting, and that's why I want to share with you, because we have now the evaluation reports of these interventions. And I want to share with you one image of this report. This is some words from the evaluation of that the children, the users of the playground report after the intervention. These are in the top, under the before, you have the feelings, emotions, and impressions associated with the previous playground, and in the after, the playground developed under the intervention. These playgrounds have been designed with a co-creation process, trying to answer to the children's desires. I don't think if this specific program is the solution, but without any doubt, is the beginning of the solution. It's a very good example on how some municipalities have tried to involve the real user, the final users of the playgrounds, to decide how should be these playgrounds. And I think that is a very great opportunity to try to look how this process have been. And the last point that I want to share with you for the close is about weight stigma and physical activity. There is increasing evidence that is showing us that physical activity have a great link with weight stigma. A very recent scoping review said that this increasing evidence revealed a high presence of weight-based victimization in physical activity, which seems to act as a barrier for physical activity engagement. What we need to rethink, we need to desmedicalize physical activity. One of the most important things that we are finding here in Spain is the idea that when we talk about physical activity all the time linked with different disease or different approach in terms of health, it's a kind of way to diagnosis of the population. Some qualitative studies are reporting that the rejections of childhood and adolescent populations to participate in physical activity programs linked with obesity prevention is increased. It's important, physical activity, to prevent obesity. Obviously, I developed my thesis on the relation between physical activity and obesity and diabetes, for sure. But it's not the most important thing of physical activity. Even less when we talk about childhood and adolescent population. Physical activity is a very incredible and strong weapon that we have to prevent those problems related with eating habits, for example. Physical activity is a very incredible way to create a healthy relation with my body. And this is very important on childhood and adolescence stage of life. We need to reopen the idea of physical activity. We need to create a new perspective of physical activity in terms of physical activity is essential for our lives, because it's one of the most important things on the human development on the earliest stage of life. Some specific message, and I would like then to answer any question and enhance and create a wider space of debate or specific question, etc. The most important thing is that physical inactivity is not about what people want, it's about what they can do. Behind the inactivity, there are hidden barriers we must recognize to create interventions to prevent it. Different lives require different solutions across the life course. We cannot use the same intervention for childhood, adolescents, and adults. We need different perspective of that. And for example, if we want to from our municipality, okay? If we want to create a program to increase the physical activity levels of the childhood population, we need to think also on what their caregivers will do. Because maybe if we can offer together a program of physical activity or space for physical activity for childhood and for caregivers, we are creating a more equal space of activity, a more equal area for practice, and we are trying to help them to accommodate their children needs and their own needs, and they can practice together on these spaces. The design environments and spaces that invite participation, not exclusion. We need to rethink about sport courts and how we design that. A group of children don't need a specific court of football to play football. If they want to play football, they can create new spaces of football by their own. We need to create a space that's set to everyone. This space is for you, and you can practice here, wherever you want. We need to create opportunities where people feel they belong. We need to create open spaces. We need to create spaces where the professionals are trained to create inclusive activities, inclusive practice, inclusive ideas, inclusive message. We need to reduce barriers don't just promote motivation. One thing that the evidence is so clear: motivation campaigns have not an important influence on the prevalence of sedentarism and physical inactivity. In Spain, we have more or less around a 30% of prevalence of absolute sedentarism in childhood population, more close to 45% in the adult populations. And when we talk about physical inactivity in the sense of don't achieve the minimum recommendation of the World Health Organizations, this prevalence rise up 75% of our population don't achieve the minimum of physical inactivity. It's not about if they want or not want to practice physical activity. It's not about the 75% of the Spanish population don't live in another world where they don't know that physical activity is great for their life. Everyone knows. We need to create new spaces and new conditions of life that allow to these populations to practice physical activity. And over all of these ideas, we should be part of the solution, not the blame. You know what? Physical inactivity is like you are with a friends working in a park, okay, and you see a bridge, and you cross the bridge with your colleague, and when you are crossing the bridge, more or less halfway across, you find two people who are drowning in the river. And with the best of intentions, you try to help them to save themselves. And you talk with them, and you say them how they can reduce the breathing to come down, and how they can use a swimming stroke to reach the shore. And in this way, you try to help those people to reach safety. And we see how, indeed, this works, at least for one of them. One of them can swim and achieve to reach the shore. But the other person tries and tries and tries and ends up drowning. And you continue crossing the bridge and talking with your colleague. You say, hey, I tried. I told them how they can save themselves. And it is very evident that was a correct approach, because I say them how to breathe, how to swim, etc., these educational policies. And one of them achieve. One of them safe. Us is safe. But the other don't. It's not about my lessons. It's not about my help. It's because he didn't effort enough. He didn't work enough. I really tried, but the other person had not the capacity for sacrifice. But everything would change if instead of doing that, these educational policies, educational instructions, we had gone down into the water and looked beneath the surface. And we would have realized that the person who drowned it had a stone tied to their ankle. That is what happened with physical activity. The person, this stone tied to the ankle is the person who cannot afford the training program. This stone is the person who works far away from home, and when they This person arrived at 7:30 p.m. We asked them to leave the children and go train. This stone is the woman who leaves the gym locker room for a swimming class and suffers all these looks that make her very, very uncomfortable, and making her feel that this space is not for her. This stone is the person that lives with obesity, who is constantly judged despite trying to be active. And I'm scientist. I don't want to say anything that is not true. Sport policies and sport interventions has not the knife to cut this rope. We cannot. This knife belongs to other policies related to gender gap, minimum wage, labor hours, structural elements, all these conditions that modify the capacity of the people to have a quality of life. However, sport policies and sport interventions indeed can reduce the weight of this stone. We can create spaces that consider all these determinants. We can design programs that consider all these conditions. We can create a space of practice that create a new form of physical activity, inclusive physical activity for everyone. We can reduce the weight of the stone. And you know what? When we crossed those bridge, at the end of the bridge, when we said to our colleague, "Hey, I did everything right," was this person that don't have the enough capacity and enough sacrifice to save himself. In the shore, there are another 40 person with a stone tied to the ankle, very close to about to go to the water, and they are listening us. We need to fight against these blaming discourses. We need to drop out this narrative about the individual responsibility of being physically active. And it's very normal, this narrative, because if the responsibility to don't have a healthy lifestyle is about them, it's not about us. If those people are the responsible, the fault don't lies on us. But this is a very cowardly and irresponsible perspective. Because if we know how to create new spaces, if we know how to create an inclusive physical activity and we don't do it, the responsibility is ours. We need to spread the voice. We need to normalize this narrative. We need to introduce the concept of inequality in the narrative of physical activity, because mass media and all these brands related to sports have a lot of more power than us. We need to change physical activity to create an affordable, comfortable, and happy space for everyone, especially for childhood population. Is fight for that could be one of the most beautiful struggles that we can face in our lives. And now I have any time to any question, comment, whatever you want.
Thank you, Luis, so much for this very interesting presentation. We have one question in our chat. In your experience, what makes people feel unable to meet physical activity guidelines, their own abilities, or their social and built environments around them? And what measures would you take to address these barriers?
I'm looking for the question to read also. Is in the chat. Or repeat the question, please.
In your experience, what makes people feel unable to meet physical activity guidelines? Their own abilities or their social and built environments around them? And then what measures would you take to address these barriers?
Okay, it's very big. The evidence says to us that the social condition of life is the most important thing on the capacity to be physically active. There are some systematic reviews with more than 300, 400, 500 articles that explains that all the time the association between socioeconomic level and physical activity is a direct association. The match or the higher is your socioeconomic level, higher is your physical activity level. So socioeconomic conditions is the most important. It's not about ability. And how can we address that? I think in the childhood population, we have a very great opportunity with the schools, because more or less those children are very similar than the rest of the colleagues of the schools, and you have more difference between the schools than within the school. So these schools could be a very great space to create new physical activity programs. Some countries believe that the specialization on one or other sport should start more or less around 13, 14 years old. Here in Spain, it's not. For example, in Spain, the specialization is very, very early. It's around the 9 years old, more or less. And some evidence show us that this is a problem, because if you constrain the possibilities of physical activity practice of the childhood population, you can reduce these opportunities. So maybe it's these two different two different ways. One related to the space of practice in terms of the school, and another change the type of practice.
Perfect, thank you. And we also have a question from the public. I see that we have a hand raise if you want to talk, Spartaco.
Yes, can you listen to me? Hi, Luis. Thanks for this very interesting webinar, because that is the confirm that the theory is not just theory. Practice is this, because I speak by my organization. I represent Margherita Vita. We are partners of HEAL project, and since from the first moment together, my colleague Alice, Santi, we have really imaged to reshape this project, because effectively the problem of the dropout of the athletes, student athletes, is a big problem. This is my small introduction. I believe that from my experience of the European project, for cover the lack of the school, public institution, municipality, where they should have one specific mission, try to cover and try to adopt the space in the urban space in public sport healthy space. But most of the situation, we have a big lack, at least in Italy, and more in particular in the south of Italy. Let me pass the joke. Maybe that's why we win a lot of projects, because we have a lot of gap to cover, and in that case, we will continue to discuss. But the problem serious is this. I appreciate a lot the study that you made with the GPS. Amazing, because really you have created an X-ray where the public sport area, most of the kids, they prefer to be free, but they don't have any recognition regarding how it's possible to play basketball, respect athletic, respect mini soccer or mini volley. Why I'm saying that, and I'm going to the conclusion. I don't make difference between the target because, of course, now the webinar is more addressed for the kids, for the student athlete. But our project experience teaches that it's possible to work with the adult and agers. In which way? We have adopted discipline like walking basketball, walking football, catchball, where the experience demonstrates that kids, youngs, and adults, they can play, funny, make physical activity, and we permit them to cover the space that your study about GPS have really works well, because these youngs maybe don't have any sense, or maybe one lack is how the sport teacher, they don't introduce this sport discipline. In that case, the experience of this adapting sport discipline helped me to put in the file this target. So what is your point of view, if it's possible, introduce adapting sport discipline for most of the big target?
We have a big problem on the biggest problem related to a specific sport practice or specialization is the sexism. I mean, we shouldn't renounce to football for girls. For sure, it's their rights. We need to create a space where girls also feel part of football, basketball, etc., etc. For sure, for sure. And we need to be compatible this struggle together with the reality today. Today, a space of design for football is not for them. It's not for girls. It's for boys. And when the leisure time starts, these boys go very fast to this field, and this field is their castle. It's only for boys.
Yeah.
So I'm not sure that the solution for this is change one modality by other.
Mm-hmm.
I think that we need to redesign these spaces, not for one or other modality, but to create a free space for play, wherever they want. And for sure, for football, boys and girls don't need any built resource, because with two backpacks you can create a goal, etc. Maybe for basket, yeah, but you can put a basket in any part of the playground without any line in the ground.
Yeah.
And we need to create new spaces without the adulthood perspective.
Okay.
They don't need lines. They don't need specific fields. They need a space, free space, and safety space. One of the most important things that girls reported in those studies is that they don't feel safe in the playground.
Yeah.
And we need to cover that. We need to. You know what? I'm graduate on physical activity and sport science. For me, physical activity is very important. But I'm not sure if we need to create a spaces in the schools during the school times for moderate to high intense physical activity. I'm not sure. You know what? Because physical activity is not only intense physical activity. And in childhood stage of life, it's very hard to isolate physical activity, high intense physical activity, from violence. It's so hard. So maybe we need to rethink that the school times are not for increased physical activity levels of the population. The physical activity levels of the population should be out of the school times, after the school. During the schools, the public spaces should be to create, comfortable spaces for everyone. We need to increase the socialization of the childhood populations. We can see now some studies how sexism that some years ago appears more or less 14, 13 years old. Now some papers are reporting that sexism is appearing at 10 years old. We need to protect the reality of our childhood populations and our schools, not for increased physical activity in the school times. And playgrounds should be an ally for that. We need to create more calm activities, more sharing activities, more social activities. You know what, Spartaco? Some of you can understand me. And during the 80s, more or less, 70s, physical activity was mainly social activity. You go to play football with your colleagues, etc., etc. Now, physical activity is workload. You go to a gym with your AirPods, practice any type of powerlifting, whatever. Sometimes you say hello to the person in the door, sometimes not. Sometimes you don't talk with anyone. You only practice energy expenditure, go to the shower, and go home. What is the difference between this practice and the work time? It's the same. So it's so hard to achieve that the people keep in practice in this type of activity, because this type of activity is so deshumanized. Physical activity is social, it's enjoy together, it's talk with others, it's share lives. Okay, what happened now? In somehow way, we are doing the same with childhood population. Physical activity should be free, should be socialized. And maybe, I don't know, with 13, 14 years old, they can select one, two, three different sports. And for that, we can have a strategic for sport, but not for physical activity, for sport, to compete. That is important for the human development also. Competitiveness is so important also. They need to understand how to do it correctly, accurate, and keeping friendship with the rest, etc. But when the boys and girls have 12 years old, 11 years old, 10 years old, the playground is not to reduce fat, is not to increase energy expenditure. It's not about that. The playground is to share their daily lives. And we need to protect that. We need to protect them from us. I'm from physical activity. I'm from the part of the evil part of this story. We need to protect them from us.
So we are reaching the final of the webinar. Thank you very much, Luis. Very clear presentation, important content. Also the debate during this end of the webinar. It's very important to take this in consideration to properly promote physical activity within communities and consider these inequalities access that highly determine the practice of physical activity. So thank you very much. Also, thank you to the audience for your interest and attention during the webinar. We are going to disseminate this important content after the webinar, and for sure during the coming years, this content will produce a strong impact in physical activity promoters. From the Gasol Foundation, we fully support this approach, as you properly know, Luis. In fact, we are working in multi-level, multi-component intervention models applied through different key settings that tries to guarantee and promote equal social and physical environments where children can practice physical activity and other important lifestyles. But in this work, we are making evident that we need to reach more knowledge about how to convince politicians and decision makers about the important role that they can play to reduce the key barriers, because finally modifying certain playgrounds and other public or private spaces need to the investment of public policies, and is needed to convince these politicians and decision makers. So, under my opinion, accumulating more knowledge about how to move the motivation of these politicians and decision makers will be very important during the coming years. So this project, the HEAL project, is reaching the end because next week, Thursday, 5th of May, we will be holding the final conference of the HEAL project, which we invite you to attend in person or online. Here you have the link to becoming registered to the conference. If you have interest, we will have the pleasure of having our partners here in our headquarters, located in Sant Boi de Llobregat, nearby Barcelona, Spain. And also the final thing is to them, is to our HEAL consortium partners, Margherita Vita from Italy, GIA Cooperativa Sociale, also from Italy, the University of Latvia, iSport from Poland, and the National Olympic Committee of Ukraine. And obviously also a special thank to the European Commission for supporting these important projects that are contributing to accumulate knowledge and to exchange important experiences within different European regions. Thank you very much to all of you, and we hope to see you very, very soon. Thank you, Luis.
Thank you.
Santi.
Thank you, everybody.
Goodbye.
Thank you. Bye-bye.